Chief of Staff's itinerary, so I don't know where he is. We WhatsApp, but from WhatsApp you can't tell where somebody is. So we're exchanging information. I haven't asked him his location. He seems well and happy. We are exchanging information on strategic issues. And it's been a long time we talked about his health, so I presume he's made a full recovery. The 16 students that were retrieved from the border, further information, they were coming from a boarding school in an area of Benin Republic that has not seen any COVID-19 transmission. So they were handed over to us at the border. We organized a vehicle for them. We determined that they were of no risk. So they were rapidly tested and moved on their way. They came from around Kano State. They were in a rush to get back to Kano State to avoid the interstate border restrictions. Mr. Governor saw them, greeted them, had some words with them, and gave each one of them 50,000 naira to help them on their way back home so that they can return to their families quickly before the state border interruption would kick in. We still have excess testing capacity. We have 3 reference laboratories in Lagos, one at Yaba, one at Luth, and one at Nigerian Institute of Medical Research. Each of those facilities is testing about up to 50 per day. So if you add that up, we have about 150 tests per day, and we're increasing that capacity by the day. So hopefully we'll be able to get to 200, and soon we might be able to get to 300, and so on and so forth. We are not using rapid tests at the moment because I've explained several times that rapid testing is inaccurate, and unless we can validate and be confident about the results we're getting, we will not be deploying rapid tests because they will have severe consequences if we are misdiagnosing patients. We would rather escalate our molecular biology tests, which are harder to do, more expensive, more time consuming, but at least when we do that test, we know it's 100% accurate. Either the virus is there or it's not there. It also helps us to determine whether a patient is no longer contagious. And that is very important for us to determine when we can release a patient back into community. Survival of COVID, or let's talk about the mortality rate, is variable from country to country. On average, in China it was 2.5. In Italy, it appears to be in a certain age of 5%. In other words, 5 out of 100 people will die of COVID in some parts of Europe. 2 to 3 would have died in China out of 100. So the fatality is still very low. We expect most of patients to survive. In Lagos, out of our 66 that are from Lagos and including our 15 off the ship, nobody has died. We have 100% survival. We've discharged 8, and there's nobody on the ward that is looking like they're going to die. So, as I said earlier on, we don't have severe disease yet amongst the patients we have. All of them range between mild to moderate illness. So our survival in Lagos so far is 100%. 100 out of 100 are still alive. And out of those patients, we've discharged 8 fully recovered. And we will soon be discharging in the next week as their tests come back negative. Remember I said we have to have 2 negative tests, because if you have 1 negative, sometimes you become positive again for a few days before you become fully negative. So just to protect the community, we're making sure that you have 2 consecutive negative results. Regarding attention, so the update, as you rightly pointed out, is 81 Of those 81, 66 are due to transmission within Lagos. We have an additional 15 cases that came off a vessel that was maneuvering off the coast of Lagos doing some oil and gas work, and that ship had a positive case. We airlifted the positive case off the ship, and we went back to test the 51 crew of the ship, and we initially found 7 positive. We removed the 7 from the ship to Yaba, and the company has isolated the remaining 44, and of those 44, another 8 have tested positive. So we will have a total of 15 from that vessel that is off the coast, that came in off the coast of Lagos. So that does not represent transmission within Lagos. So we're removing 15 from the 81, otherwise it will give us a false impression of what's going on in Lagos. So we only had an increase of about 8 new cases over the last 2 days. Of those 66 that are in Lagos, we're still contact tracing those that came in by air, and we are just about getting to the end of the 14-day surveillance, where a lot of people are coming off the contact tracing list from the imported cases, but we're contact tracing the contacts that are arising from the in-community infection. And those contacts are much less than the imported cases, because in the imported cases you will always have the manifest of the airline as well as the contacts that they've had when they were on ground. The question around severity, most of our patients are experiencing a very mild to moderate degree of illness. In fact, we don't have anybody that's requiring ventilation at the moment, which is a symptom of what we would describe as severe disease. So if we were to put some percentages on those 66, I would estimate that about 33 of the 66 are mild, and about 33 are showing moderate disease, just characterized by severe fever, feeling weak, some coughing, and headache and body pains. But it is not extending to affect the organs such that we have lung failure or kidney failure. So we haven't seen any of that yet. Never be 100%. What we're trying to do is just slow down movement. As I said earlier on today at another press briefing, we're just trying to avoid 2 random people coming into contact with each other. That's what we're doing with social distancing and lockdown. So why must we stop 2 random people from coming into contact with each other? Because many people with COVID-19 don't have any symptoms, but yet they're secreting the virus. So the way of stopping this outbreak is just to, for a period of time, to avoid 2 people literally coming within 2 meters of each other or touching any surface that somebody else has touched. So a lockdown is just essentially to grind down movement in a city, to minimize it to as much as we can. It will never be 100%, but our job is just to slow it down to as much as we can. We don't want to come out with, security brutality. We don't want to demonstrate. This is not a military state. We're a civilian democracy. Children will be children. We discourage it, and when we see it, we would advise against it. But also, as civilians, we must play our part in this whole process of lockdown and social